what I want to do here is let me share with you guys some certain things about who is currently disrupting this industry that we're in, the home health industry. And if you're not aware of this, you better be aware of it now, and I want to share that with you, okay? Because if you want to expand, if you want to exist in this industry, I want you guys to pay close attention. So let me talk about Kindly Care right now, okay? Kindly Care is this company that's disrupting our industry right now. It's a startup. You guys are hearing about all those silicone startups, those unicorns like, Facebook, Instagram, they're disrupting their area. But guess what? A lot of people are starting to realize that the home care industry is ripe for disruption. So they're a startup that helps clients find, hire, and manage at-home caregivers. And they raised $5.4 million in a Series A round and is planning to expand to the East Coast for the very first time. They're currently servicing Arizona, California, Florida, Nevada, and Texas at this very moment. So pay attention to this. Eventually, if you're a home care company, they're not going to need you anymore, because people who want to become caregivers can sign up for Kindly Care, and people can then find them directly from there, look at the rates. They can lower the cost of the rates now because the client can pay them directly, so that the middleman, which is you, doesn't have to be there. Now, you can gripe all you want about it, but pay attention to this. I'm sure that you used Uber before, right? I'm sure that maybe you used Amazon already, right? Because that's what Amazon is. Before, you have to go to the retailer. Now, you can go straight to Amazon. And the people that sell on Amazon are the manufacturers now. They're selling direct to consumers now. So you have to pay attention on who is disrupting your area and how can you actually be part of that. Here's another thing that is disrupting us, and this is actually the federal government, right? If you're a medical home health agency, you should be familiar with a pre-claim review. This came out in Illinois, but it's about to be released all over the US. So if you're not even familiar with the pre-claim review, talk to some agencies in Illinois when they first released it in Illinois, and there was a disruption where agencies were closing down, not getting paid. It was crazy in Illinois when they released this. So to combat the improper billing, the Centers for Medicare and Medicaid Services, CMS, in 2016 rolled out the controversial pre-claim review demonstration in Illinois. So what it is, before you can admit the patient, you have to show proof that the patient really needs the services before you can actually admit them and bill them. And it caused problems for a lot of agencies because they didn't know how to handle it. Now, that was overturned, right? They had to stop it because there were lawsuits put in place and there were things that they were missing. But guess what? That's the reason why they only launched it in Illinois. They wanted to see what was going to happen. What were the fine-tuning things that they had to do? So they removed it and they revised it. Now CMS has a new version of the pre-claim review that's coming out. It's now called the Review Choice Demonstration. Right? Allows home health agencies to forego prior claims authorization in favor of post-payment review. Meaning, they're going to give you a choice. Do you want pre-claim or post-claim? So pre-claim, prove to us that the patient needs the services. So you're going to do that. Or do post-claim, meaning, fine, we'll do it after. But guess what? If you provide the services and you still don't provide them the information that they need, they don't pay you. Or there's that other option they're trying to look into where they say, we won't do any of it at all, but you must allow for a 25% cut in payments. Imagine what's going to happen if you lose 25% of your income because of mismanagement within the company and how you pay people, the expenditures that you're doing. If you're not paying attention, 25% loss is a lot of money and can cause a lot of problems for a lot of agencies. So are you paying attention to this that's happening? Amedisys. You should know what Amedisys is, right? It's probably one of the largest competition for every home health agency, right? They have home health, hospice, and personal care all over the United States. So guess what Amedisys just did? They bought Compassion Care, which is one of the largest hospice providers in the United States. Why are they doing home health, hospice, personal care? Because they want to be able to close the market. If they market to a potential referral source, they can say, hey, doctor, we do everything for you. One referral, one place, one number, that's all you need to call. So my question to you guys is, what's your growth strategy? What are you doing to create growth for your company? Are you planning to add multiple flows of income? If you're a home health agency, you should really look into providing home care personal services. If you're a home health, why don't you go reach out to a potential hospice company and say, hey, let's join forces a little bit. You don't have to buy each other out, but say, hey, if you have home health patients, refer to me. If I have hospice patients, I'll refer to you. We can do power partners marketing, help each other out, market together, show up together as a team. Link up with another marketer from the hospice if you're a home health. If you're a home care company and that's it that you do want to open up a home health? If no, find a home health that does not have home care and link up with them. What's your growth strategy? You can't tell me that I just want to get by month to month. You have to have a strategy for growth. What's your 6 month, 1 year, 3 year, 5 year goal for your company? Can you map it out? Do you have a whiteboard that you can put together? Do you have a vision board that you can put together? Can you visually see where you want to put yourself and position yourself in the near future? If you don't have that, people that don't look at growth will fall. So another company, Bain Capital, right? Bain Capital is one of those companies that actually invest in Silicon Valley, like in Facebook, social media, Instagram, those kind of stuff. They find companies, especially apps and businesses that are growing, and what they end up doing is they invest in those companies, and then eventually that company has an IPO, it sells out. They can sell their stock options from there, and they make millions and millions of dollars. Well, guess what? Bain Capital decided to now get into the home care industry. Okay, and so what they did was they went ahead and bought Arosa and Live Home to create a national in-home care provider now. And then they acquired Epic Health Services. It's a national home health care services and pediatric skilled nursing company in 2016. So now they are trying to disrupt this industry. They're going up against the big boys like Amedisys as well. Those guys are competing. You have to understand, if you're just a regular company, $1 million company, you're competing against billion-dollar organizations right now. And you have to be ready for that. Look, David slayed Goliath. It can happen. But you need to position yourself, right? How did David slay Goliath? He practiced. He believed in himself. He knew he could do it. But you have to have a plan out there for yourself, for your company, to really create that multi-million-dollar company. Kindred at Home is another disruptor, right? It's the largest provider of home health and hospice services in the US. They signed a preferred partnership now with what? With Comfort Care. So think about that. Kindred provides hospice and home health, but instead of starting their own home care industry, they created a partnership agreement with Comfort Care, which is also a national franchise company out there. So that partnership is part of the Comfort Care strategic plan to build relationships with providers across the healthcare continuum. So guess what? That's what Comfort Care did. They wanted to be able to link themselves up. Why are you not doing that right now in your industry?